Hi there, and welcome back to Understanding Medications. We've just taken a look at the first two processes of pharmacokinetics, the absorption and distribution of medications, and right now we're going to be taking a look at the metabolism of drugs. As we concluded our last lesson, our orally administered medication had been absorbed into the hepatic portal venous system on the way to the liver. And recall that our medications have no choice if they're orally administered because of the fact that any absorption that occurs from the middle portion of the esophagus all the way down to the middle portion of the rectum is going to go into the hepatic portal venous system on the way to the liver to be metabolized. And that can be problematic for a number of different medications. For instance, glycerol trinitrate or nitroglycerin for angina, or sometimes called angina, and also morphine have what we call a very high first pass effect. And that means that the orally administered medication is very significantly altered before it gets to systemic circulation. For orally administered glycerol trinitrate, the bioavailability is less than 1%. And that means that less than 1% of the medication that is orally administered is going to be reaching systemic circulation unchanged. And that's the reason we most frequently administer the medication sublingually in the form of a spray. Spraying it under the tongue avoids that first pass mechanism and it gets the medication into the system very quickly. So the bioavailability of the medication increases dramatically if we administer it that way. For morphine, the bioavailability is around 30%, so we can still administer it orally, but it is oftentimes intravenously injected, resulting in 100% bioavailability. Intravenous injections and intra-arterial injections are the only types of administration that consistently achieves 100% bioavailability because nothing can change the drug from the syringe to the blood. Another way that we can get morphine into the person's system is to administer a drug that turns into morphine in the liver. Codeine is what we call a prodrug, and it does exactly that. It is an inactive drug that has a bioavailability of 90%, and the codeine is altered to the active form, which is morphine, the first time it enters one of the liver cells. The liver is a primary site for metabolism of drugs, but it is not the only site. In fact, many of the cells of the GIT and many cells throughout the body are also involved in some metabolism of drugs. But the liver has a full array of the enzymes that are needed for the drug metabolism, and it receives all of the blood from the GIT, so we consider it the most important organ in metabolism of drugs. It's important not to fall into the habit of thinking that the metabolism of drugs always makes the drug inactive. Like I just noted, in some instances, the first metabolic process in the liver can make some inactive prodrugs into active metabolites. It can make active drugs into more active metabolites. It can make a drug more toxic, or it can make a drug inactive. In each case, we are changing the drug from one molecular form to another. So the main goal of the liver is not to immediately inactivate the drug, but rather to make it more water-soluble and easier to excrete. We can excrete drugs in a variety of different ways in the lungs and through our sweat, for instance, and we can also excrete it in the feces, but the most common way to eliminate drugs is by the kidneys. And in order to excrete it by that route, we need it to be water-soluble. The liver makes the drugs water-soluble in two stages, which are termed phase 1 reactions and phase 2 reactions. In general, the phase 1 reactions involve cytochrome P450 enzymes. The cytochrome P450 enzymes are a huge superfamily of enzymes that induce or unmask a polar group. In other words, these reactions make the molecule more water soluble. Besides making the drug more water soluble, the phase 1 reaction also, in simplistic terms, gives the liver an additional target to come back to change the molecule even further the next time that it goes through the liver. In other words, the very site that we changed the first time is often the target of other liver enzymes the next time it goes through the liver. Then, if the metabolite is still too lipophilic, or in other words, too fat soluble, the next time the drug goes through the liver, the phase 2 reaction occurs, which adds a polar group to the drug so that it is very water soluble and we can definitely excrete it by the kidneys. To picture these reactions, let's take the example of aspirin. Aspirin is a prodrug. It's taken as acetylsalicic acid. In the first pass, aspirin is going to be transformed into salicic acid, and that happens mainly in the liver, but it also happens to some extent in the stomach and in the intestinal mucosa of the GIT. And that reaction is termed a phase 1 reaction. The liver then uses another enzyme to attach a very polar molecule to the salicic acid, and in that case, the active metabolite is changed to a relatively inactive water-soluble substance that can be easily excreted. And make sure that you reinforce your knowledge about the metabolism of drugs by engaging in the quiz for this section. We will see you there, and thanks for joining us. We've just seen that the liver metabolizes some prodrugs into active metabolites, and one of the most common drugs that is a prodrug is aspirin. So right now, use your knowledge of absorption and metabolism to consider what would happen in the following scenario. Pushpa has learned that topical anti-inflammatory agents can help with arthritis of the fingers. She wants to save money, so she mixes aspirin with a cream and administers it topically. Will she get anti-inflammatory effects of the aspirin in that local area? And you'd be correct if you had said that she's very unlikely to get direct anti-inflammatory effects if applied in that manner. Drugs are formulated for specific applications. So, for instance, intravenous aspirin. If aspirin is given intravenously, it is given as lysine acetylsalicate and not acetylsalicic acid, which is the oral form of aspirin. It can be very dangerous to just assume that a medication made to be taken orally is safe and effective to be administered in another way. So if aspirin were to be administered topically, the first problem is that much of it would not be absorbed. But also remember that aspirin is a prodrug, and as such, it needs to be metabolized into the active form, and the main place for that to occur is in the liver. So the aspirin that got through the skin into the interstitial spaces would need to get into the liver where it would be metabolized into the active form. Let's take one more question to make sure you understood what happens in the liver with respect to metabolism. On the first pass through the liver, the enzymes in the liver, including the hundreds of cytochrome P450 enzymes, can make the drug A, active, B, more active, C, less active, D, pharmacologically inert, E, more toxic, F, less toxic, G, more water soluble, or H, all of the above. And you were correct if you had said all of the above. The liver's main job is to make things more easily excreted, so it makes things more water soluble. But in the process, the first step may actually make the drug more toxic. A good example is the first metabolite of ethanol, the alcohol that we drink, which is acetaldehyde and much more toxic than ethanol. Let's get on to getting a good picture of the final process of pharmacokinetics, which is the excretion of medications.